Hey, Margie here. Did you know that medications to treat allergies and asthma can negatively impact your bones? Well, it's unfortunate because so many people have allergies and asthma today. Well, the good news is there's another approach, and we're going to delve into that with our special guest, Dr. Darin Ingels. And Dr. Darin is a licensed naturopathic doctor, author, international speaker, and leading authority on nutritional medicine. He is the co host of the upcoming Allergies and Asthma Summit. He is a former Lyme patient who overcame his own 3-year battle with Lyme disease after having failed conventional treatment and became progressively debilitated. Dr. Ingles found that proper diet, lifestyle management, and nutritional therapies worked with his body to heal instead of against it. He then applied what he learned about diet and lifestyle management to his own patients and found that they recovered faster with less side effects. Dr. Ingles has now treated thousands of patients with chronic illness using his novel approach, many of whom have gone to live healthy, symptom-free lives. Dr. Ingles has been featured on WebMD, MindBodyGreen, BeWell, ThriveGlobal, and many other platforms. He's the author of the Lyme Solution, a 5-part plan to fight the inflammatory autoimmune response and beat Lyme disease. And today we're focusing on allergies and asthma and what the negative effects of the medications are and what is a different approach. So this is filled with so much information, whether it's for you or whether it's for someone you know who has allergies and asthma, just a lot to learn. So stay tuned. Welcome, Dr. Darin. I'm really happy to talk to you because this topic is something that affects so many people. And, everybody's doing their own thing, but a lot of what they're doing with the medications can also increase the risk of osteoporosis. So I think the information that you're going to share with us today can just be so valuable. So thank you for joining me.
Oh, it's always a pleasure, Margie.
So let's start out. Let's start out with why for osteoporosis this is an issue. Why some of the medications. So do you want to start out with the antihistamines? Why that's a problem?
Well, let me backtrack a little bit first. I think it's important for people to understand, when you talk about bone development, 90% of your bone mass develops from the time you're born until you're 18 years old. And so many people who are dealing with allergies and asthma, these often start from childhood. So, if you think about, medication and its capacity to interfere with bone development, if that happens early in life, that sets the stage later in life that, your risk of osteopenia, osteoporosis goes up significantly. So, in my practice, I see a lot of children, I see a lot of young people who have both allergies and or asthma, and the majority of them come in on, multiple medications, and often they're on, antihistamines, they're on leukotriene inhibitors, they're on an inhaled steroid, sometimes oral steroids. So when you get into the polypharmacy of managing these illnesses, I think about sort of the long-term effects of these medications, and there's a lot of them, but one of those is, specifically affected on bone health. So if we think about like antihistamines, so antihistamines, there's different types of antihistamines that are what are called H1 blockers, and that's most of what people think about when they think about antihistamines. So this is Benadryl, this is Zyrtec, Claritin, Allegra, Xyzal, and this is what most people take when they've got run-of-the-mill hay fever. If you got the itchy eyes and runny nose and sneezing and you get seasonal allergies, you've probably been recommended at some point to take an antihistamine. There are also H2 blockers, and these are more around the gut. So this is things like, Zantac, that are designed to block these receptors specifically for people who get reflux, heartburn, and these type of gastrointestinal problems. There are also H3 receptors, or H3, H3 receptors. So we don't make drugs that block H3. H3 receptors are found throughout the body, but mostly found in the brain. And you can imagine if we started blocking these receptors, histamine is a neurotransmitter, and it's an important neurotransmitter. So this idea of shutting down histamine, again, it may help control some of your allergy symptoms, but it can also interfere with normal neurological function, which is why people often have the experience of taking Benadryl and they feel tired. They get lethargic because it's interfering with histamine receptors in the brain, and that often makes people feel sedated and tired. So the risk of antihistamines as a whole in terms of bone development, we know from the research that for premenopausal women who take antihistamines, there is a 3 times increased risk of developing osteoporosis over the course of their life. And that's significant. Again, because most of the people, it's pretty unusual that you start developing allergies and asthma after menopause. Can happen, but that's definitely not the norm. So often, again, this is happening in younger people. We also know that for elderly people, there's a 2 to 3 times risk if they are taking antihistamines of having a hip fracture. And of course, one of the big risks of osteopenia, particularly osteoporosis, is having some sort of fracture either in the hip or the spine. We also know that H1 receptors are found all throughout the body, including bone. And what's really interesting is that the H1 blockers, so again, this is Claritin, Zyrtec, Allegra, they can actually interfere with two parts of bone development. It interferes with osteoblasts. So these are the cells that make bone. And they also inhibit the mineralization of bone. So you kind of have a 1-2 punch of these antihistamines is that they're stopping your body from making bone. And then if it stops making bone, the mineralization, so that's what makes bone hard. So, osteoporosis, I'm sure your community already knows this, it's really the matrix of the bone that breaks down. It's not even necessarily the mineralization problem. But in this case of antihistamines, it's interfering with both processes. So, we've got this impact directly on the bone of, these antihistamines that are really stopping you from making bone in the way that's supposed to be done. And we know that's happening early in life. We know it's happening later in life. So no matter where you are in the course of your lifespan, if you've been on antihistamines long term, now what's long term? That varies, from study to study. In most cases, they're looking at people who've been on these drugs for many, many months. So, for the people who gets its occasional seasonal allergies, they take Zyrtec for a day or two because the pollen count happened to be high and they're getting a lot of sneezing. That's probably not going to be much of a problem. But if you're a year-long person that's having allergies and you're on these medications every single day, that's where I would be concerned about your long-term risk.
It's interesting. It's not really talked about that much. Steroids and the corticosteroids are talked about a tremendous amount as being a risk factor for osteoporosis, and people know that. But it's not the same. People really don't discuss the antihistamines, and it's talked to, and people are on those. There are a lot of people who are on that, and some. I think that's so interesting though about very early on because women, the majority, 85 to 90% of their bone by the age of 18, and men by 20. So what happens when you're young is absolutely essential, and sometimes people will just get a bone density and, all of a sudden they see a low number and they don't, it could be that they just never developed all that bone. One of the possible root causes is way back they were on the medications. You wanna
Oh,
just
it's
also
inter
yeah.
Yeah, I mean, it's interesting because, if you look at medications whole, I mean, there are a lot of medications that we know that interfere with bone growth, right? We know that antacids can interfere with bone development because it inhibits the gastrointestinal absorption a lot of your nutrients. So, things like, you know,
Yeah, all the
uh,
PPIs
all
and
the
yeah,
PPIs, yeah,
so prevalent.
omeprazole, prosoprazole, I mean, all those ones all, interfere with, potentially again, in absorption of your nutrition. So again, even if you're eating all the right things to help, your bones grow, if you're not absorbing those nutrients, the net effect is that, don't build bone the way you're supposed to. And we know that antidepressants can also, a lot of the SSRIs for the mechanisms I don't fully understand, but I know it's been reported that these drugs as well. We have a lot of people on SSRIs, particularly during the pandemic. I think, at least in my practice, I saw a lot of people going on antidepressants for, various reasons. I think it was a rough time for a lot of folks. And I don't think that discussion ever happens with your doctors like, hey, we know there's a lot of side effects that go along with antidepressants, but I don't ever hear any doctor talk to their patients about the risk on their bones. But, again, this is just one of the many medications. And it's interesting. There was a really large study done in Korea on people with asthma. It was almost 170,000 people over the course of like 14 years. And what they found is that as your asthma was less controlled, your risk of osteoporosis went up. So those who were well controlled had the lower risk. Those who were moderate controlled had moderate risk. And the ones who were really uncontrolled had the highest risk. And again, they don't really go into the why, but I would surmise that the more uncontrolled you are, probably the more medication you're taking and probably the more steroids you're taking or antihistamines. So it's probably an effect of the medication, but I just thought it was an interesting study that said it was very large and it was over a long period of time. But if you're an asthmatic and you're not well controlled, of course you've got to deal with the issue that you're not breathing very well. That's pretty important. But beyond that, you need to think about your bone health.
So true, and it's unfortunately, it's so common today, both asthma, allergies, all of these things are affecting so many people, and I love the work you do because there's things that can be done, and there's things that, for root causes, and there's all sorts of really more natural approaches or to even look what's going on beneath the surface when we're dealing with this. So you wanna share because I think for everybody listening, because again, this is so prevalent and what else can how can we look at these from a different lens and maybe have a greater impact so we don't have to take all of this medication?
Yeah, well, before we get into that, I just want to round out the medication part about steroids because, again, for people, we used to think when you were on inhaled steroids or nasal steroids, things like Flonase, they used to say, well, it's just a little bit, it stays local, it doesn't really have a systemic effect. And we found over time that that's not really true. And, part of what steroids do is they increase the it diminishes the absorption of calcium from your gut. It also causes the urinary excretion of calcium. So you do get a net loss of calcium when you're on steroids. And again, it also lengthens the time that osteoclasts, these are the cells that break bone down, stay in your system. So now you've got less calcium coming in and the cells that are breaking down bone stay there longer. So it's almost like you had more of these cells breaking down bone. So again, steroids, oral steroids, particularly high dose prednisone, has been known forever, and everyone knows this. They can break down bone, but again, even if you're on inhaled steroids or nasal steroids, you do need to be cautious because again, it's not uncommon that people are on these medications for many, many, many years.
Absolutely, and it's a big risk factor, and it's something that is well known, but, it doesn't help the situation that we know about it because when people are on it, then they're losing bone, and then they have to deal with the bone loss. So, it's something that if we can even think of other ways and what can be done, but I know also the allergies, and before we get into everything, they can affect exercise too.
Right.
Exercise is so important for our bones.
Yeah, if you've got, really bad allergies or asthma and you're limited in your ability to exercise, that's just another risk factor because we know how important is exercise for building bone. And if, you can't breathe very well and every time you try to exert yourself, you get congested, you have difficulty breathing, you're not apt to do that kind of activity. So if we can open up your airways between your nose, your throat, your lungs, get you breathing well, then you're more likely to do the kind of exercises that we want you to do to improve your bone strength. And again, this is another factor that I see in my practice that a lot of doctors aren't talking to patients about because again, we focus so much on sort of the acute problem and not really talking about these long-term effects. But the good news is there's a lot of things we can correct that.
Yeah, that's what I like, and that's what I love about the work that you do. So why don't you share some of the things that can be done? I mean, I know I love your approach in terms of, how you deal with this. So why don't you
Yeah,
share?
well, I mean, fortunately, there's a lot of things we can do, particularly in the natural world. I mean, my goal when someone comes in, if they have allergies and asthma, is to get them off medication. These medicines in some cases can be life saving. And if you're having an acute asthma attack, albuterol and these steroids can sometimes really help, really save your life. But long term, again, they have a lot of side effects and they don't fix the problem. So, how do we get to the root of the problem? Well, both allergies and asthma to some degree have this element of mast cell activation. So if we can control the way your body reacts to different allergens, then we can start to shift the way your body responds. I mean, if you think about allergies as a whole, it's really an overreaction of your immune system. Why is it some people are allergic to cats and other people aren't, or ragweed or dust? It's funny, in all the years we've been studying allergy, we really don't understand what sensitizes people to these different allergens. And I always like to use the example of peanut allergy. It's so common here in the US. And you look at a country like Thailand, where peanut oil is used in everything, their incidence of peanut allergy is extremely low. So it's not by virtue of just, having exposure to a lot of a particular allergen. There's something else that changes the immune system. Now, to a degree, some of it's genetic. We know that if one parent has allergy, there's about a 20% risk of the child having allergy. And if both parents have allergies, that goes up to 80%. So definitely there's a genetic disposition. And beyond that, I think it's a lot of environmental exposure. And of course, we could probably have a very long discussion about all the toxins in our environment that probably contribute to that. But nonetheless, I think if we're really trying to get to the root of the problem, if we can identify what those triggers are, now we know what we need to fix. So again, we've got a lot of supplements, we've got a lot of medication that will control symptoms. We can use mast cell inhibitors. There's things like quercetin and vitamin C and stinging nettles that do a good job of controlling allergy. We've got other herbs like ephedra and um, I'm drawing a blank, but we've got a lot of other plants that can help open up your airway. But again, you have to keep taking these things ongoing to keep your symptoms controlled. But one of the things that we do in our practice is, we test people. We try and find out again very specifically what bothers them, whether it's a food, mold, pollen, cat, dust, dog, feather, whatever it is. And then we use some sort of immunotherapy. So immune therapy is a way to actually change your immune system, build your immune tolerance, because essentially that's what happens is your immune system has lost tolerance to whatever it is in your world that triggers the reaction. And asthma, most asthma anyway, is an allergic reaction in the lungs. I mean, there is cold induced asthma, there's exercise induced asthma, which doesn't necessarily involve an allergen. But the overwhelming majority of people, there's some trigger that causes their lungs to start to close up. So as we control the allergy part, we can open up the airway, we can stop these symptoms. So, most people are familiar with immunotherapy because they've heard of allergy shots. If you go to a conventional allergist, they'll skin prick test you or do blood testing. They'll say, okay, you're allergic to dust or ragweed. And then every week you come in and they literally inject you with dust and ragweed. But at a very specific concentration, it starts to modulate the way your immune system reacts to these allergens. And what they do over time is they keep giving you a little bit more as time goes on, and they get to a point where you're at a maintenance dose, and then you stay on that often for many, many years. So we don't do the allergy shots like that, but we do what's either called sublingual immunotherapy or LDA, low dose allergy therapy. So sublingual immunotherapy has been around for over 100 years. It's widely used throughout the world, except the United States. But the concept is the same, is that instead of injecting the thing you're allergic to, these are drops that we make up in our office and you put underneath your tongue and they start to desensitize you against whatever it is that's causing your symptoms. So again, if it's cat or dog or dust, we put a little bit under the tongue. And the way that immunotherapy works is you have cells in your immune system called dendritic cells. These are the cells that basically tell the rest of your immune system what's part of you, what's not part of you. They're the trainers, or they're the drill instructor, if you want to think of it that way. And so when we present it to these dendritic cells, now you've got dendritic cells in your skin. This is why allergy shots work. So the concept again is really the same, but when you get allergy shots, there is a small risk of having an anaphylactic reaction to the shot. With sublingual immunotherapy, there's very little risk. Again, there's over 1,000 studies on sublingual immunotherapy. It's been used for 100 years, millions and millions and millions of doses given. So it's incredibly safe. And they studied it in children and adults. So it's really appropriate for any age. So, we test people, we find out very specifically what triggers them, and then we make up drops, including those specific allergens. And then again, over time, we build up their dose and get them to the point where hopefully they get to a place where these allergies don't bother them anymore and they can stop the treatment. So this is one of the few things I found in practice that actually, I always hate to use the C word, cure the problem, but it does. So again, when we can stop the allergy, stop the asthma, again, we get them off the medication, we allow them to be more physically active, and all that ultimately helps their bone health.
Wow, well, I don't understand a couple things. Number 1, how long does this typically take? Is there a range? Or I guess it depends on the severity of the allergies and the asthma?
It depends. It depends on the kind of allergen. It depends on the exposure. I mean, the rule of allergy is always if you can avoid the allergen, avoid it. Like if it's food, if you know you're allergic to peanuts, you stop eating peanuts. If you're allergic to mold or pollen, depending on where you live in the world, that's not possible. I mean, if you live in Texas and you have pollen allergy, you're hosed because there's a ton of it and it's almost year round. If you live in Florida, California, again, our pollen season's almost year round. So when there's ongoing exposure, it can take longer. But my experience is the earlier you start. So when I treat young children, it goes much faster than when I'm treating an older adult. But clinically, again, we can see improvement in symptoms sometimes within a matter of a month or two of starting treatment. Although it may take longer to get to a point where they can stop the drops altogether, at least their symptoms are controlled and either they don't need as much medication, either antihistamines or steroids. In many cases, we can get them off their medication completely. So that's a huge win because even if they need to stay on the immunotherapy, because there's really no side effects to it or very few, it's much safer than them being on these long-term medications.
Wow, it's just interesting, as so many things, why isn't this out there? It just makes so much sense. Why do you think? Just people don't know about it, or they're set in their
Yeah,
ways, or
I think people just don't know. And again, if you are in the conventional medical system, your primary doctor says, okay, you have allergies. They send you to the allergist. I mean, allergists know about sublingual immunotherapy. I mean, again, there's a lot of research on it. But in this country, we are a for profit medical system. And unfortunately, sublingual immunotherapy is generally not covered by insurance. So allergists get reimbursed by giving you shots. They don't get reimbursed by putting drops under your tongue. So honestly, there's no financial incentive for allergists to change the way they do business. I do know some allergists now that are doing sublingual immunotherapy in addition to conventional allergy shots for people who want that. But as a whole, I know that the American Academy of Asthma, Allergy, and Immunology, this is the big allergy society in our country, they have a position paper on sublingual immunotherapy that says, well, we don't really recommend it because we don't know what the right dose is. We don't know how long you need to be on it. There's too many ifs. And to a degree, that's kind of true because when you look at the research on sublingual immunotherapy, there is a 10,000 fold difference in doses that were used in the study. I mean, that's the difference between giving someone 1 milligram of a drug and 10,000 milligrams. That's a huge range. But what's really interesting is that whether it's 1 milligram or 10,000 milligrams, it tends to work. So again, I think it's kind of a lame excuse of why they're not doing it. There's research out there on how you translate like what you find on a blood test, kind of how bad your allergy is to what dose you need to give for sublingual immunotherapy. There's like a dose equivalent, and the concept behind it's really kind of the same. And the fact again, in Europe, it's so widely used because most of Europe is socialized medicine. They're trying to save money. And there's a French study that found that sublingual immunotherapy is about a quarter of the cost of doing allergy shots. So again, a lot of Europe likes it because it's a cost savings, it's safer, it's easier. And again, you administer it at home. You don't have to go in every single week to see your doctor to get the allergy shot. So, it's just I wish more people knew about it. Again, it's something that I'm a part of the American Academy of Environmental Medicine, and this academy has been training doctors on doing different types of immunotherapy, including sublingual immunotherapy. So there are doctors out there that do this. And I'm sure if you looked in your local area, you could probably find someone not too far that does it. And I also want to mention LDA, low dose allergy therapy. This is a really interesting therapy as well. This has been around since the 1960s. It was developed by an ENT surgeon out of the UK, Dr. Len McEwen. They used to call it EPD or enzyme potentiated desensitization. And he kind of found by mistake that when you take really highly diluted extracts, more than what the conventional allergists were using even at the time, and you mix it with an enzyme called beta glucuronidase. And this enzyme is naturally found in your white blood cells. That enzyme seems to have a modulating effect with whatever you mix it. So if you mix it with dust or cat or dog or ragweed, and it helps build your immune tolerance much in the same way as conventional allergy shots. So the way that he did it was as an intradermal injection. So you kind of inject it between the layers of the skin. So it's not going all the way through like a true allergy shot. And he did this for decades, very, very successfully. And then there was a doctor here in the US, Dr. Butch Schrader, who trained with Dr. McEwen, and he was bringing it over from the UK. And then somewhere in the 90s, I think the FDA kind of got a bug up their hindquarters and they didn't like importing stuff from the UK. So they put the kibosh on that. So Dr. Schrader had it recreated in the US with a pharmacy and renamed it LDA or low dose allergy therapy. So really the same concept. And so this is made by a pharmacy, and there are different mixes. There are 2 food mixes that have the same foods, just in different concentrations. There's an inhalant mix, which is pretty much everything you breathe: mold, pollen, dust, cat, dog feather. And then there's a chemical mix for people who are chemically sensitive. So with LDA, there's really no testing involved at all. It's based on your clinical history. You can do testing, but it's not necessary. So if we know that certain foods bother you, if we know that, when the spring pollen hits and you are a congested mess, you got seasonal allergies, we can give you the inhalant mix. Or if you go to the mall and scented candles and things like that bother you, we can give you the chemical mix. So the big difference with LDA is it's done as an intradermal injection. And what we found is that we can put it under the tongue. The shot really hurts. I've had it done myself. It's like 1,000 bee stings, and it lasts for about 30 seconds, but it's really uncomfortable. Uh, but we found if you do it under the tongue, again, because these dendritic cells are in the skin, they're in the mouth, the mechanism seems to work the same. So we just do it as a sublingual administration, and you get it every 7 weeks. So unlike, allergy shots that you often do weekly, or sublingual that you do every single day, this is just every 7 weeks you get your dose, and the dose is the same for everyone. So it's not as specific as sublingual immunotherapy, but the idea is that, let's say you're allergic to 3 molds and 5 pollens. Well, there's 70 different things in there. So we cover the ones you are allergic to, and the other ones, well, it doesn't matter because you're not allergic. So it doesn't seem to bother or aggravate people because it's got all this extra stuff in it. And again, it's been around for now 60 years, very safe. There are no large scale studies on this. There's no money on doing that kind of research. But the fact that, again, millions of doses have been given over time, I'm not aware of anyone who's ever had an anaphylactic reaction to LDA. And again, we use it in children, we use it in adults. So, with immunotherapy, it's always a function of, what works best for each person. I mean, all of this is out of pocket. So what works best for each budget. But the idea behind it's really the same. Again, is this is a way that we can control the immune system, modulate to the point that allergies and asthma stop bothering you.
Wow, and you don't use those in conjunction together. They're you wouldn't do one. Would you do them at the same time, or you try something
Well, we
first?
can. I mean, sometimes we'll do sublingual immunotherapy for food, and we'll do LDA for inhalants. Or sometimes we'll do sublingual for mold and pollen, and people do LDA for food. So yeah, sometimes we mix and match, really depending on the degree to which the allergen bothers them. Like, I have some people come in that only get spring hay fever. It lasts for 4 to 6 weeks, and that's it. So often we'll do LDA because do they really need to do the daily doses of sublingual? They can, but LDA may work just as well, and it's a little easier and maybe a little less expensive. So in those cases, that may be a better option. So it's really, again, looking at the individual, what their needs are. The one thing I know clinically is sublingual immunotherapy definitely works faster. I think it is that daily dose that helps retrain your immune system a little faster than the every 7 weeks. But again, it's just a function of what works best for each person.
Wow, that's so encouraging, actually. And in terms of asthma, what have you found to be the best things that you use in your practice?
Well, again, immunotherapy is a great way to control it. I'm a huge fan of using, there's different inhaled things that we can use to also help open up the lungs. We know that people with asthma tend to be very low in glutathione. So you can actually inhale glutathione and goes directly into the lungs. And I found for a lot of people that really helps control their asthma. I'm also a huge fan of using cromolyn sodium. Cromolyn sodium is what they call semi-synthetic bioflavonoid. So it's kind of a natural substance. It's tweaked one molecule in the lab, so I can't say it's 100% natural, but it's pretty close. And cromolyn sodium is a mast cell inhibitor. So again, if we can stop that mast cell activation in the lungs, we can stop often those asthma triggers. So between inhaled glutathione and inhaled cromolyn sodium, that's really a very effective way to help manage asthma while we're doing all these other things. We're still talking about people's diet. We're talking about people's gut health. Anything that controls your immune system is going to be helpful. But again, these are two other things. I mean, these are both prescriptions, so it's not something you can just buy over the counter, but you can definitely talk to your doctor about these. But, they're natural, they're safe, and they can be very effective at managing asthma.
Wow.
And they're not steroids, so we don't get all the ill effects of steroids.
Well, that's what I'm loving, thinking of all those people that are living on that inhaler and they're doing damage to their bones as well as so many other areas of their body and organ systems. But wow, this is really fantastic. So tell us, because I know you're hosting a summit where you're really taking a deep dive into this topic. You want to share a little bit about the summit and what types of things that are being covered there?
Absolutely. Well, it's an allergies and asthma summit and it's completely free. So all you have to do is sign up, and every day for a week you're going to get access to, I think, 7 or 8 different speakers. We have almost 50 speakers that are talking everything from hay fever to asthma to eczema to gut health and even like neuropsychiatric issues. Now, most people don't realize that allergy can affect your brain as much as it does your nose and throat and lungs. And so for people that have chronic depression, insomnia, brain fog, a lot of this can be allergy in the brain. So we've got different experts talking about that. So we would just love to invite your community to come listen in. If you know someone who's struggling with allergies and asthma, this is a great opportunity to listen to some of the top experts in the world on, managing all these different aspects to help control the symptoms and, get your life back. So it's running from March 13th through 19th. There'll be an encore weekend, I think 2 weeks after that, where you'll have an opportunity to listen to all the talks. But again, it's completely free. So we don't want people to pass up on this great opportunity to get a lot of really valuable information that's going to help change your health.
Wow, I'm really excited about it because this isn't an area that I really delve into that much. It hasn't been one of my problems, but it is in my community. People do have a lot of problems and they are treated conventionally with these medications that do affect their bones,
Yeah,
as
absolutely.
you're saying. In the summit, do you have people discussing the environment and environmental toxins and things?
Absolutely.
Because that's such a big
We
issue.
talk everything from using personal care products at home to what you're putting on your skin. We talk a lot about mold and mold toxicity and how that impacts your health. Chemicals, herbicides, pesticides, glyphosate. Had a great talk with Jeffrey Smith on glyphosate and GMOs. So again, we really cover the bases of all these things that are impacting allergies and asthma. So again, we really hope people take this opportunity to tune in because I think you're really going to enjoy.
And the interesting thing is whenever you deal with any of these issues, all those things are a win-win because they also affect your bones. So by eliminating the GMOs and the glyphosate, you're gonna just in many ways help your overall health as well as your bones. Well, this sounds really, really wonderful, and I'm excited about it. And I think, I just think that we're to bring the knowledge to people that it doesn't have to be this way. Like, there's other ways to deal with allergies and asthma that aren't going to affect your bones or just it's just not gonna have the side effects. They're so much more natural. Even when you said about the nutrients, vitamin C is amazing for the bone matrix. I'm trying to think what else you said a couple things and I'm thinking, "Oh, nettles. Nettles is fabulous for your bone." So even when you switch over, not that you wanna take to that type of thing, even just to manage symptoms versus the medication that you're taking, it can make such a big difference, and it's also nourishing for your bones and your body, so I think
Absolutely.
yeah, I think all of that is great. Well, I can't thank you enough. Is there any last minute things you wanna share with people?
Well, I just wanted to caution people, please, if you're on medication, don't just abruptly stop without consulting your doctor. We've talked about a lot of, things you can do. This is done in conjunction with being mindful of, coming off medication when it's appropriate. So if you're working with a pulmonologist, allergist, your primary doctor, just make sure you're doing it in a very safe way.
And also, Dr. Darren, how can people work with you? How are you working with people? You wanna share that?
Yeah, sure. So we see people in person. My clinic right now is in Laguna Hills, California, and we see people in person and we work with people remotely. So I work with people all over the world. And so if they just come to my website, it's dariningelsnd.com, DARININGELS, N is in Nancy D.com. And we'd love for people to join our community. We got a lot of great information to share. And again, if you're interested in working with me, we can make that happen as well.
Oh, that's great. Well, I'm excited. I know how much work and thank you because I'm in the middle of my summit as well, and I know how much work this is. It's really a labor of love when you do a summit because am I right? There's so much that
Absolutely.
goes on and choosing the experts and really getting the message across in a big way and going even beyond your own knowledge. That's what I just love about the summits. Everybody has their piece of the puzzle and you bring that all together. So And everybody can sort of, it's sort of like a smorgasbord. You look at it and you see all these different people. Well, what could I use? Yeah, this, I could pick this. And so I just think
Exactly.
it's such a win-win situation. So thank you for all the work you're doing. And I know so many people are going to be helped by the summit. And that's what's so exciting. And thanks for sharing this information because I think a lot of the things you talked about really aren't well known, but yet it can really make a big difference in people's lives. So thank you so much. It's always a pleasure to be with you.
Great. Thank you so much, Margie.
Wow, I learned so much from Dr. Darin, and I hope you did as well. And this is a very important topic because so many people are affected with asthma, allergies from a young age. And as Dr. Darin talked about, it affects our bones, our overall health, these medications. But the good news is there's other ways to treat it. And there's just so much that can be done that to me, it's very empowering. And I just want to learn as much as I can. And I'm very excited about the upcoming summit, the Allergies and Asthma Summit that Dr. Darin is co hosting. And I just think there'll be a tremendous amount of information there and things that all of us can benefit from. So the link to that is in the show notes, as well as the link to Dr. Darin's website, where you can further contact him if you have any of these issues, as well as he's an expert in Lyme disease too. So thank you so much for tuning in, and I look forward to seeing you on the next episode.